1. A staff nurse is prioritizing care for multiple patients. Which patient should be seen first? A patient with a post-operative temperature of 100.4 degrees Fahrenheit, a patient complaining of 8 out of 10 pain, a patient with an oxygen saturation of 88%, or a patient who needs assistance ambulating. Answer: the patient with an oxygen saturation of 88% should be seen first. Rationale: a low oxygen saturation level indicates potential respiratory distress, which is a priority over pain, mild fever, or ambulation needs. The Airway, Breathing, and Circulation (ABC) framework prioritizes oxygenation issues first. 2. A nurse is delegating tasks to an unlicensed assistive personnel (UAP). Which task is most appropriate for delegation? Assisting with ambulation, assessing a patient's pain level, administering oral medication, or educating a patient about discharge instructions? Answer: assisting with ambulation is the most appropriate task for delegation. Rationale: UAPs can assist with non-clinical tasks such as ambulation, while assessment, medication administration, and patient education require the knowledge and judgment of a licensed nurse. 3. A patient with COPD is experiencing shortness of breath. The nurse places the patient in high Fowler's position and applies oxygen via nasal cannula, but notes no improvement. What should the nurse do next? Answer: notify the healthcare provider immediately. Rationale: if a patient with COPD does not improve with oxygen and positioning, further interventions, such as adjusting oxygen flow or additional treatment, may be needed. Prompt medical evaluation is necessary. 4. A nurse receives a new admission who reports a severe allergic reaction to penicillin. What is the first action the nurse should take? Answer: place an allergy ban on the patient and document the allergy in the medical record. Rationale: ensuring that all healthcare providers are aware of the allergy is critical in preventing medication errors and potential anaphylaxis. 5. A nurse observes a nursing assistant repositioning a patient with a stage 2 pressure ulcer by pulling the patient up in bed. What should the nurse do first? Answer: intervene immediately and educate the nursing assistant on proper repositioning techniques. Rationale: dragging a patient can cause skin shearing and worsen pressure ulcers. Education on safe patient handling is essential to prevent further skin damage. 6. A nurse is caring for a patient with a potassium level of 3.0 milliequivalents per liter. What action should the nurse take first? Answer: notify the healthcare provider and anticipate potassium replacement. Rationale: hypokalemia can cause cardiac arrhythmias and muscle weakness. Prompt intervention is necessary to prevent complications. 7. A nurse is caring for a patient with a chest tube who suddenly becomes short of breath and tachycardic. What is the priority nursing action? Answer: assess the chest tube for kinks or disconnections. Rationale: a compromised chest tube can lead to tension pneumothorax, which is life-threatening. Ensuring the tube is functioning properly is the priority. 8. A patient with dementia becomes agitated and attempts to leave the hospital. What is the best action for the nurse to take? Answer: redirect the patient to a quiet, secure area and provide reassurance. Rationale: patients with dementia may become confused in unfamiliar settings. Providing a calm environment and reassurance can help reduce agitation without using restraints. 9. A nurse is caring for a patient who suddenly develops slurred speech and facial drooping. What is the priority intervention? Answer: activate the stroke protocol and notify the healthcare provider immediately. Rationale: slurred speech and facial drooping are signs of a stroke, which requires rapid intervention to preserve brain function. 10. A nurse is reviewing orders for a patient with heart failure. Which order should the nurse question? Furosemide 40 milligrams IV, a 2,000 milliliter fluid restriction, potassium chloride 20 milliequivalents per oral, or normal saline ivory at 125 milliliters per hour? Answer: the nurse should question the order for normal saline IV at 125 milliliters per hour. Rationale: patients with heart failure require fluid restrictions to prevent fluid overload, which can worsen symptoms. High IV fluid rates should be avoided. 11. A nurse is assigned 4 patients. Which patient should be assessed first? A patient receiving IV antibiotics, a patient with a blood glucose of 80 milligrams per deciliter, a patient with a blood pressure of 90/60 millimeters of mercury, or a patient with a new onset of confusion? Answer: the patient with a new onset of confusion should be assessed first. Rationale: a sudden change in mental status may indicate an underlying medical emergency such as stroke, sepsis, or hypoxia. Early intervention is crucial. 12. A nurse is preparing to administer digoxin to a patient. What assessment must be performed before administration? Answer: assess the patient's apical pulse for 1 full minute. Rationale: digoxin can cause bradycardia. The nurse must ensure the heart rate is within a safe range before administering the medication. 13. A nurse notices a colleague documenting medication administration before giving the medication. What is the appropriate nursing action? Answer: report the incident to the nursing supervisor. Rationale: pre-charting medication administration is a serious safety violation that can lead to medication errors and must be addressed immediately. 14. A patient on warfarin therapy has an INR of 5.2. What is the priority nursing intervention? Answer: hold the warfarin and notify the healthcare provider. Rationale: an INR above the therapeutic range increases the risk of bleeding. Holding the medication and consulting the provider is necessary to prevent complications. 15. A nurse is providing discharge teaching to a patient prescribed a new antihypertensive medication. What should the nurse include in the teaching? Answer: instruct the patient to change positions slowly to prevent dizziness. Rationale: many antihypertensives can cause orthostatic hypotension, increasing the risk of falls. 16. A patient is scheduled for surgery and states, "I don't understand why I need this procedure." What is the most appropriate nursing action? Answer: notify the surgeon so they can further explain the procedure. Rationale: informed consent requires that the patient fully understands the procedure. The surgeon must provide additional information if the patient is unsure. 17th. A patient receiving chemotherapy reports new onset of a fever. What is the nurse's priority action? Answer: notify the healthcare provider immediately. Rationale: chemotherapy patients are immunocompromised and at high risk for infections. Fever may indicate sepsis, requiring prompt intervention. 18. A nurse notices that a patient's urinary catheter has been in place for 7 days without a documented reason. What should the nurse do? Answer: contact the healthcare provider to discuss catheter removal. Rationale: prolonged catheter use increases the risk of infection. Catheters should be removed as soon as possible when no longer necessary. 19. A nurse is caring for a patient with a DNR order who becomes unresponsive with no pulse. What is the appropriate action? Answer: provide comfort measures and notify the healthcare provider. Rationale: a DNR order means that resuscitation efforts should not be initiated. The focus should be on comfort and supportive care. 20. A patient reports difficulty breathing and hives after receiving an antibiotic. What should the nurse do first? Answer: stop the antibiotic infusion immediately. Rationale: signs of an allergic reaction require immediate discontinuation of the offending agent to prevent anaphylaxis. 21. A nurse is caring for a patient who just had a bronchoscopy and is requesting a sip of water. What should the nurse do first? Answer: assess for the return of the gag reflex. Rationale: a bronchoscopy involves inserting a scope into the airway, which can temporarily impair the gag reflex. Administering fluids before it returns increases the risk of aspiration. 22. A patient with a history of heart failure is admitted with worsening shortness of breath and reports gaining 5 pounds in 1 week. What is the priority nursing assessment? Answer: assess for signs of fluid overload, including lung sounds and peripheral edema. Rationale: rapid weight gain in a patient with heart failure often indicates fluid retention, which can lead to pulmonary edema and respiratory distress. Early assessment allows for timely intervention. 23rd. A nurse is caring for a patient with a PCA, patient-controlled analgesia pump, who is difficult to arouse. What is the nurse's priority action? Answer: stop the PCA infusion and assess the patient's respiratory status. Rationale: difficulty arousing a patient receiving opioids via PCA may indicate respiratory depression, which is a medical emergency. The infusion should be stopped immediately, and the patient should be assessed. 24. A nurse enters a patient's room and finds the patient on the floor. What is the nurse's first action? Answer: assess the patient for injuries. Rationale: ensuring patient safety is the top priority. Before moving the patient, the nurse must assess for injuries to determine the appropriate next steps. 25th. A patient receiving a blood transfusion complains of chills, itching, and back pain. What is the nurse's priority action? Answer: stop the transfusion immediately. Rationale: these symptoms indicate a possible transfusion reaction. Stopping the transfusion prevents further complications and allows for appropriate intervention. 26. A nurse is preparing to administer morning medications to a patient who has just been prescribed a new antibiotic. The patient states, "I have never taken this before. I am allergic to a lot of medications." What is the nurse's best action? Answer: hold the antibiotic and verify the patient's allergy history. Rationale: administering a medication without verifying potential allergies increases the risk of an adverse reaction. Ensuring patient safety requires thorough allergy assessment. 27. A nurse is delegating care to a licensed practical nurse, LPN. Which task is appropriate to delegate? Administering an IV push medication, completing a dressing change for a stage 3 pressure ulcer, performing an initial patient assessment, or developing a care plan? Answer: completing a dressing change for a stage 3 pressure ulcer. Rationale: LPNs can perform wound care, but IV push medications, initial assessments, and care planning require the judgment and skills of an RN. 28. A nurse is caring for a patient experiencing severe respiratory distress. Which intervention should be done first? Answer: place the patient in a high Fowler's position. Rationale: positioning the patient upright maximizes lung expansion and improves oxygenation. This should be done immediately while further interventions are prepared. 29th. A nurse observes another nurse drawing up insulin in a syringe without scanning the medication barcode. What is the most appropriate action? Answer: remind the nurse to scan the medication before administration. Rationale: barcode scanning is a key safety measure to prevent medication errors. Addressing the issue immediately reinforces safe medication administration practices. 30. A nurse is providing discharge teaching to a patient with a new prescription for warfarin. Which instruction is most important? Answer: avoid foods high in vitamin K, such as spinach and kale. Rationale: vitamin K affects warfarin's effectiveness. Consistency in dietary vitamin K intake is essential for maintaining therapeutic INR levels. 31st. A nurse receives a report on 4 patients. Which patient should be assessed first? A patient with a blood glucose of 210 milligrams per deciliter, a patient who has just returned from a colonoscopy, a patient with a blood pressure of 160 over 90 millimeters of mercury, or a patient reporting chest pain? Answer: the patient reporting chest pain should be assessed first. Rationale: chest pain may indicate a cardiac event requiring immediate assessment and intervention. Other conditions are important, but less urgent. 32nd. A nurse is caring for a patient with cirrhosis and notices confusion and a hand-flapping tremor, asterixis. What is the nurse's best response? Answer: notify the healthcare provider and anticipate an order for lactulose. Rationale: confusion and asterixis indicate hepatic encephalopathy due to elevated ammonia levels. Lactulose helps remove excess ammonia, reducing symptoms. 33rd. A patient with pneumonia is receiving IV antibiotics and oxygen therapy. The patient's oxygen saturation drops from 95% to 88%. What should the nurse do first? Answer: increase the oxygen flow rate as prescribed. Rationale: a drop in oxygen saturation indicates worsening respiratory function. Increasing oxygen delivery helps improve oxygenation while further assessment is conducted. 34. A nurse finds a patient with a seizure disorder actively seizing in bed. What is the nurse's priority action? Answer: turn the patient onto their side and protect their airway. Rationale: turning the patient prevents aspiration and maintains an open airway. Protecting the head and ensuring safety are crucial during a seizure. 35th. A nurse is teaching a patient with heart failure about daily weights. What instructions should the nurse include? Answer: weigh yourself at the same time each morning using the same scale. Rationale: consistency in weighing helps detect fluid retention early, allowing for timely intervention. 36. A nurse is caring for a patient who is prescribed morphine for pain. The patient's respiratory rate decreases to 8 breaths per minute. What is the nurse's priority action? Answer: administer naloxone as prescribed. Rationale: naloxone is an opioid antagonist that reverses respiratory depression caused by opioids. Rapid administration is necessary to prevent further decline. 37. A patient receiving heparin therapy has a PTT of 100 seconds. What is the nurse's priority action? Answer: stop the heparin infusion and notify the healthcare provider. Rationale: a PTT of 100 seconds is above the therapeutic range and increases the risk of bleeding. Stopping heparin prevents further anticoagulation. 38. A nurse is preparing to administer an intramuscular injection to an adult patient. What is the preferred site for administration? Answer: the ventrogluteal site. Rationale: the ventrogluteal site is preferred for intramuscular injections in adults because it has fewer nerves and blood vessels, reducing the risk of complications. 39th. A patient with diabetes mellitus has a blood glucose of 50 milligrams per deciliter and is awake but shaky. What should the nurse do first? Answer: provide a fast-acting carbohydrate, such as orange juice. Rationale: hypoglycemia requires immediate treatment with a rapid-acting carbohydrate to prevent further decline in blood sugar levels. 40. A nurse is caring for a patient with a chest tube and notices continuous bubbling in the water seal chamber. What is the nurse's best action? Answer: check the system for an air leak. Rationale: continuous bubbling in the water seal chamber indicates an air leak, which can compromise lung re-expansion. Identifying and correcting the leak is essential.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!